Hello and welcome. This is Jim Karp with Raymond. I have Danielle Matley along with Don McAnally. Now, it's been a couple weeks since we talked, and you gave us an update before on what's going on in the healthcare industry. There's a lot happening. What's current at the moment?
Jim, a lot of practitioners are really kind of chomping at the bit to get back into their practices. I think that, they've been off long enough. It's been a couple months. They're eager to get their practices reinitiated, but in an intelligent way. They're following state guidelines, state and local guidelines. Many of them are limiting direct patient contact right now to only emergencies. Okay. But patients are needing care. They can only go on for so long with a situation that then is going to require care. We talked about earlier, Jim, a lot of these practices have pivoted to telehealth. And really, that's kind of worked out pretty well for them so far. But it really hasn't, met every need of every patient because there's not that direct patient contact. Certain practices continue to remain open, OB-GYNs, oncologists, so on and so forth. They have to remain open, Jim. You can't stop a baby from coming. They're obviously going to stay open to help keep the practices going. But patients and providers are struggling. They need care. They're scared a little bit. I've been talking with many of our clients. Ophthalmologists are feeling the pain right now. They've got patients who are going to need cataract surgeries. They're not getting those cases. Radiologists, they're not seeing much happening within their practices. So there's not being patients that have been diagnosed. The whole elective care continuum has really been put on hold right now. It's largely unsettling right now for many people out there.
So with that as the backdrop, a lot of people, like you're saying, Don, are ready to get back at it. So what is the startup? It's not going to be business as usual. What would you guys recommend?
Right now it's hard to tell. Things are changing day by day. New executive orders are coming out, kind of updating, extending them out further. So right now, Michigan has the shelter in place order through May 15th, but they also have the public health emergency, which is limiting some of that non-emergent surgeries, et cetera, through the end of May. So we're kind of watching day by day to see what happens and when they can open back up for everything.
Danielle, we're starting to see some practices and some health systems that are really getting ready to get going. McLaren Health System that has hospitals throughout the state of Michigan, they announced that they're going to start gearing up for some elective procedures. I've had some surgery centers talking to us as well that they're starting to get ready for it. I think people are starting to see the break in this and realizing that we got to get back to business as usual in the healthcare environment.
Okay, so with that as the backdrop, then, if they're going to recall employees, are there certain items that practice managers and owners should be aware of?
Jim, there's been a lot of discussions going on. We've had discussions regarding the PPP loan, right? The Paycheck Protection Program, unemployment. Okay, a lot of practices have laid off their employees and they've accepted the PPP monies. So there's a lot going on right now. One of the things that we're encouraging clients to do is when they're calling back their employees to send a return to work notice in writing. Okay, you want to make sure you document this. We talked earlier about a lot of fear out there. There's employees that are afraid to come back to work. So if we're going to have them come back to work, we got to make sure that we put that in writing. And we're also recommending that employers require employees acknowledge the receipt of that letter. Okay, so we're really going to document this thing up significantly right now. So those are some of the things that are going on with it.
Don, you talked about the PPP and recall to work. And one thing important to note is the SBA came out last week or early this week and said that if you recall an employee and they turn you down and don't come back, that will not affect your forgiveness. So documentation and having it in writing is going to be key so that you can prove that you did recall them and they said no.
Danielle, also along that way, I had a number of employers that were very concerned about employees that might not come back to work. What could they do from an HR perspective? I think in the state of Michigan, there's some special rules on that, aren't there?
Yeah, in Michigan, right now, there's some rules out there that you cannot discipline or discharge employees with COVID-related issues. So caring for a family member or if you yourself are inflicted with COVID. So it's going to be really important to make sure you're following all the compliance rules.
We're going to have to continue to work together on this, really, as employers, employees, as a society as a whole, to get past this pandemic. So,
absolutely. Hey, just yesterday they did a webinar. Susan West, our director for HR, has a turnkey solution and a package all set for clients that covers from soup to nuts everything you need to do and take into consideration from the COVID perspective. That's talking about templates, policies, procedures, making sure your employee handbook's all up to date. So that might be one thing that some people can check into. And then
Jim, I
also,
really think that's a great idea. Sorry to interrupt you, but from an HR perspective, it's so important for these practices to make sure they have their HR policies and procedures really buttoned up. So that's a great thing for clients to consider.
yeah, and you know what I learned listening to her? She went on for about an hour or so, and there's going to be a series of webinars that are coming out. Everybody's handbook today is no longer valid. Just the way everything's changed in the last 2 months, everybody really needs to update everything. And the beauty of this is that they've taken it all into consideration, have a lot of it prepackaged. What you just have to do is translate a little bit and make some tweaks. So that's an exciting outcome.
A little bit concerned about plaintiffs' attorneys and what they might be trying to make out on these types of situations. I think our clients need to be prepared for that.
Absolutely. And that's a good point. We always recommend run it through your attorney as well. So in addition to the HR things and taking care of that, what can be done today from a practice perspective to prepare to open up?
I think the main thing right now is going to be mitigating fear and managing how that's going to look in once you start opening up. So employees are going to be fearful, patients are going to be fearful. So making sure you have your plan in place, that you're communicating what steps you're taking, what additional PPE you might be investing in, how you might be rearranging your waiting room, and letting your patients and employees know all the steps you're doing. Just yesterday, I got an email from my personal doctor stating, here's what we're doing to open, here's the things we're updating, and it just provides a level of comfort. So I think kind of making your plan, communicating that plan so that you can eliminate some of that fear.
Danielle, that's interesting that you got a communication from your personal physician. We've been talking with a number of clients about continuing to utilize technology in many different ways, shapes, and forms. We've seen some clients that are putting together their own little impromptu YouTube videos about coming back to their office. These things not need to be all that sophisticated. Utilizing your iPhone to just talk about some of the measures that you're taking within your office to help the patients gain comfort with the practice, I think is really an important thing. I think practitioners can do a lot of interesting things to get ready for this. Danielle, a number of other things that I think people can do is, get in contact with your professional advisors and also really look to your professional societies. We're getting a lot of good information out from those professional societies that really are going to help practitioners get ready for their practices.
Absolutely. I think it's going to be important that you don't have to recreate the wheel. Those societies are coming out with some pretty good documents that are comprehensive that are going to show these practices what they need to do to reopen, and use those. And you don't need to recreate the wheel here.
Practitioners are understanding that, hey, these patient visits are going to take a little bit longer when we start this whole thing off. Okay. I was talking with a dental client yesterday, and she was telling me about all the steps and actions they're taking, whether it be a face shield, a sneeze guard there, donning PPE from head to toe. I mean, Jim, they are really going to take significant steps to help make sure that they themselves, and more importantly, their patients, feel safe and are kept safe.
The other thing that's going to be important is some financial modeling. So as you begin to open and look at some of these costs and additional things that you're going to have to consider, it's going to be important to kind of lay that out and see where you're headed financially too as you go along.
Danielle, I think that's really important. We're getting we're moving on to the next phase here. We've got the PPE money that we've got to manage. We've got the restarting of the business. It's going to be like starting it from anew again, building up your working capital. How are you going to manage that all? I really think it's important for practitioners to really pay close attention to their finances during this time and to not ignore them. I think if you ignore them, you kind of risk your own peril.
So beyond the financial modeling that we just talked about, there's probably still quite a few other strategies that need to be considered as everybody's getting ready to open. What are some of those important ones?
Social distancing, Jim, is gonna permeate into physician and dental offices for the near term future, probably the long term future as well. Waiting rooms are going to be reconfigured. Check in and check out areas are going to be reconfigured. What we're seeing, Jim, is practices that are posting notices around the office and encouraging patients to not bring as many people along with them to their patient visit. Maybe right now you might not be able to follow your child back into the exam room or the operatory for their hygiene cleaning. If they're 14, 15 years old, then they can go back to the exam rooms themselves. I think you're going to be seeing situations where they're not going to be allowing mom or dad to come back with them right there. Unless, of course, it's a patient advocate issue. I think that's probably going to be the only time you're going to see that. So practitioners are really going to focus on social distancing. they're also going to have to determine how many patients they can see in a day at each location. I think they're going to have to get a little bit more strategic about spacing out their patients, trying to make sure that patients aren't crossing as much in the hallways or in the waiting and exam rooms. They're going to have to determine which of their patients can really be pivoted to telehealth. What types of visits is it more efficient and effective to use technology than what they've used in the past? So it's going to kind of take away from some of that close interactions with patients. And speaking of close interactions, waiting rooms are going to change significantly, in a physician office place. I think you're going to see much fewer chairs in a waiting room. You're going to see elimination of really waiting lines in a room. The waiting rooms are going to be rearranged. There's going to be no more magazines, no more books, no more food or drink stations. Some of those niceties that physicians were putting out there.
Hey, Dan, just today I called our vet, and the vet has a policy that basically said, you can come over and pick up the pills. What you have to do is pay now. So I paid on the phone, and then I sit in the car, call them when I get there, and they bring the pills out to us. So I'm going to assume that there's going to be a lot of people sitting in cars instead of waiting rooms as well.
Jim, I've actually heard some clients that are starting to get those little restaurant buzzers. When you're going to a restaurant, they give you one of those buzzers to let you know when your table's ready.
Mm-hmm.
You're seeing practitioners investing in those and saying, that you're going to be waiting out in your car until the buzzer buzzes you in, and then you're going to come in for your visit. So the environment's going to be a lot like you've experienced there with your veterinarian practice right there. But, patients that are sick, we're starting to see situations where physician practices are looking at separate entranceways for sick patients, looking to room them as soon as possible. Okay, getting patients into their room so that the providers can see them is a really important thing. It's just floating office staff is another thing that we're seeing, that, staffs are going to have to be cross-trained so that they can help, room people, maybe check people in, check people out, really helping to make that patient visit as expedient and as efficient as possible, all in an effort to maintain social distancing and helping to make sure that we're keeping staff and patients as healthy as possible.
How about automation? Are they going to be changing up automation? I know you mentioned the buzzers. Is there going to be additional things as well?
So this kind of leads into screening. So some of the things we're seeing is you're going to have additional screening before the patient comes in, when the patient is in the office, automated touchless thermometers. We've seen some practices hiring people just to screen patients when they come in, advising your staff about the facts of how it's contracted. If you have, it only takes 15 minutes for direct close exposure to contract it. So really doing that pre-screening will help eliminate some of that exposure.
So I think you are going to see a lot of automation occur. Danielle, we've got some practices that maybe people might come in and check in on an iPad, okay, and having touch screens that they would use to enter in all their information. I think you're going to see an increased use of those types of technologies, but practices are really going to have to figure about how they're going to utilize those, because they may have owned, 6 or 7 iPads that they would give out to patients as they came in there to enter in certain bits and pieces of information. That's going to have to change a little bit, right? Sanitizing those things and maybe encouraging applications or having apps, smart apps on your phone that they're going to be able to use, as opposed to using, one common iPad or one common tablet device that's owned by the practice.
Yeah, the other type of screening we're going to see is providers screening their schedule ahead of time. So looking at what patients can maybe be postponed, converted to telehealth, maybe segregating their appointment times. So the high risk population has you have less patients in your office during a certain period for the high risk population. Just a lot of different ways to look at your schedule and figure out how you can best utilize your schedule with the limited visits you're allowed to have.
Danielle, that's going to really require some upfront planning and communication with your patient base, isn't it? Because this is going to be a different environment, not just for the clinician and their staff, but also for the patients. It's going to be a completely different business experience. I think these clinicians, the successful ones, will be the ones that have planned for this and have had this thing set up in place, not only so that they can manage the expectations of their staff and their patients to provide for an optimal patient visit.
We've covered a lot of topics today. There's a lot happening. Final thoughts on what people should be doing to plan ahead to get ready.
Jim, I think it's really coming down to almost a strategic planning type mechanism for practices right here. I think you have to have meetings with your staff. Your staff is missing you. You have to reach out to your patients to let them know that you're thinking of them, to let them know that planned visits that you've had to put off because of the stay in place, shelter in place thing, that we're going to look to bring that back on board and to let your patients know, excuse me, what you're doing to make sure they're kept safe. I think it's going to really be something that's going to, seek to comfort everyone involved so that they all feel good about the experience moving forward on the other side of this pandemic.
Danielle, final thoughts.
I would echo Don's comments. Create your plan, get ready, communicate that plan to your staff, your patients, make sure everybody knows what you have going on, and, get ready.
Danielle, even though we're all looking forward to positive things in the future and getting on the other side of this pandemic, I think that as business owners, as practice owners, we need to be prepared for a worst case scenario. Okay. There's some, epidemiologists out there that are saying that we could have a second wave of this. And with that in mind, I think we need to also make sure that practitioners are keeping things in mind as if this does come back at us again in Q3, Q4, or early next year, that they're prepared for it, that they have systems and processes in place that will help them be successful in the event this occurs again. So.
Great. Thank you, folks, for your time. Very enlightening. I'm sure we'll be covering these topics again in the near future. Stay safe, and we'll talk soon.
Thanks, Jim.
Thanks, Jim.